All right, let's shift our focus now. Well, cases in the UK have come down, but cases in the United States, for instance, continue to rise. Now, cases in the UK are rising, in the US, I beg your pardon, are rising, and despite cases rising in the United States, now the CDC has had a rethink on masks. As cases rise, masks are back, even for fully vaccinated Americans. The US CDC has reversed an earlier relaxation on masks. The new rules say that masks are mandatory in areas with more than 50 cases per 100,000 for a period of 7 days. Masks are also mandatory now in areas which have more than 8% positivity rate for 7 straight days. Fully vaccinated people have to wear a mask in the US again. What does this essentially mean? Does it mean that the US CDC was perhaps too early to jump to a conclusion where it could ease mask restrictions? Dr. Ayeshta Dwivedi, the Assistant Professor of Medicine at the Lenox Hill Hospital, Northwell, joins us. Dr. Dwivedi, thanks so much for speaking with us. It's very interesting to see what's happened. Why do you think that the mask mandate has been reversed? I mean, we know that cases are rising, but can one perhaps link this to the Delta variant?
Hi, Rishita, and thank you for having me on the show. You're absolutely right. The CDC is revising its guidelines, and they're expected to come out next Tuesday. This obviously occurs in the setting of increased infections being seen mostly because of the Delta variant and predominantly in unvaccinated people. Back in May, CDC had relaxed the guidelines for masking. Vaccinated people indoors or outdoors, regardless of the gathering size, did not have to wear masks, meaning the mask mandates were lifted for vaccinated people. Now we've seen that about 50,000 new cases were recorded on July 26th, with about 33,000 new hospitalizations. In the setting of this new data, CDC is now recommending wearing masks regardless of the vaccination status, mostly indoors and in settings that are highly transmissible. Now, what these settings are remains to be seen when the guidelines come out. My guess is it's going to be public transportation, which already exists, hospitals and workplaces, which are indoors, and there's limited circulation.
Right. The CDC has also said that new data shows that while vaccines are highly effective, there are rare breakthrough infection cases that are being reported. This is, of course, connected to the Delta variant. What more is known about breakthrough infections in the United States at the moment? Is there definitive data to talk about breakthrough infections linked to the Delta variant?
Yes, nothing is perfect. And I preface this by saying that vaccinations are not 100% effective. What we know is that they are highly effective, meaning about 95% effective. That was shown in the clinical trials. That still leaves room for some breakthrough infections, unfortunately. Having said that, if you are vaccinated, the risk of you getting hospitalized or critically ill is extremely low. Right now, we're seeing that about 97% of the new infections are in unvaccinated people. And the few breakthrough infections that we have seen are mostly in the elderly or people with comorbidities, bringing into question, maybe we need a booster dose in the future, and this is currently being studied for people with compromised immune statuses or perhaps people of a certain age, but that remains to be seen.
Right. Do you think it was a mistake to have lifted the mask mandate in the first place? And what does this essentially tell us to the rest of the world, that masks are here to stay?
I think that's a great question. I wouldn't say it's a mistake. I think we just have to learn to evolve our lifestyle based on the situation of this pandemic. I think that cases were at an all-time low 2 months ago when the mandates were lifted. And now we have to revise the guidance and the guidelines based on the new Delta variant, which is about 80% of the new infections. So I think it's more we have to be adaptable during this pandemic. If, if something that's been important throughout the course of this pandemic. And also, I think we have to take it one day at a time. That's all I can say.
All right. We have to take it one day at a time. Thanks so much for joining us, Doctor. Also, like Dr. Anthony Fauci has said, that this is science. It keeps on evolving. It's not really a flip-flop.